Hello, I am Commissioner Emma Darnell, Fulton County District 6. Welcome to Mighty Six Conversations. As you know, Conversations is a monthly information communication program. It focuses on the sustainable community, economically strong, environmentally safe, with liberty and justice for all. The topic for today's conversation will be Fulton County senior adults. What's going on? Thank you for joining us. I will be back in a moment. Joining me in the conversation today is Dr. John M. Thompson, the new director of the Fulton County Department of Aging and Youth Services. Dr. Thompson earned a Bachelor of Science degree from the University of South Carolina and the PhD degree from Walden University. Welcome, Dr. Thompson.
Thank you, Madam Commissioner.
We are so happy to have you here to join us today on the Mighty Six Conversations.
Thank you.
And also to join us here in Fulton County as we seek to meet our responsibilities under the law, which is to protect the health and safety of all of the people. We are particularly interested in talking with you today because of the focus which we have in this county, in fact all the nation's counties, on people.
Yes, ma'am.
And that means all the people, irrespective of age or youth or income, or as we say here in Fulton County, from Alpharetta to Palmetto.
Yes, ma'am.
From Bankhead to Buckhead. Dr. Thompson, over 10 years ago, the Atlanta Regional Commission published an extremely important article entitled "The Graying of the Atlanta Region." I think this was shortly after the 2000 census. The graying has changed now, hasn't it?
Yes, ma'am.
This is a gray region. The 2010 census data and other materials which your department has made available to us, shows us that it's here.
Yes, ma'am.
What was predicted, even though District 6 is a relatively young district, you see the same trends in District 6 that we see throughout the nation.
Right.
And that is a dramatic increase
Right.
in the number of senior adults. Interestingly enough, though, the fastest growing group has been the group between 45 and 64, and they're still working.
They are.
Let's talk about demographics a
Absolutely.
little bit, Dr.
Absolutely.
Thompson, because folks might think that we're still in church basement.
No, absolutely not. And so, as you mentioned, seniors are living longer, and so we have more seniors. The population will double in just the years to come. And as we focus on seniors, we're talking about seniors who are very active. So it's no longer...
They're active, aren't they?
They're very active. So it's no longer hitting a certain age and just retiring off into the sunset. It's still wanting to be engaged. For those who have the financial resources to volunteer their time, they want to find those opportunities. Then we have other seniors who have not properly prepared for retirement, whether because of physical reasons, they need medication, they need to be able to see doctors and don't have the appropriate insurance. So very thankful that we have the Affordable Care Act to help those seniors who need the extra help. But however, we have those seniors who want to work, right? They want to work because they need the additional dollars, whether it's to help to pay for transportation, whether it's an opportunity to engage in recreational activities, or to be able to raise that grandchild. They need that additional money. And so it's really up to us as public servants to be able to find the jobs for them. As I often tell folks, and coming from Washington, D.C., if you're looking at seniors, they are, and I'm not a senior, but I say one thing about seniors. I would rather hire a senior. We know that they are dependable. We know that they have strong work ethic. and that they're loyal to the job. And so not discriminating against the younger generation. I'm a part of the younger generation. But if I have to put my bet on who I want to hire, you can depend on that senior.
Well, employment is a major issue for us. The department for several years has conducted surveys and taken other steps to make sure we know what the real needs and interests are of Fulton County seniors. And of course, you all have told us you can't get that from looking at the television or reading in magazines. The best source of information about senior adults' interests and needs are the senior adults themselves.
Right.
This may be a good time, Dr. Thompson, for us to mention what the department has planned in terms of its strategic planning this year for seniors.
Absolutely.
It's not going to be conducted from your office, is it?
No, ma'am, absolutely not. I've had a chance to do strategic planning work for other organizations at the federal level, the Centers for Medicare and Medicaid Services, and also from my last post with the District of Columbia Office on Aging. And the ability to develop the strategic plan is one thing. I tell folks, anybody can develop that plan.
You can get an outline from off the online, can't you?
There you go. You look at the textbook and do it.
But I noticed, though, from your plan, that it doesn't begin with the online.
No, ma'am. No, you have to go to the people.
You got to go to them.
You have to go to the people. The folks have to shape that strategic plan. And the purpose of a solid strategic plan is to be able to shape policy. The purpose of policy is to be able to shape the budget. So we want to be able to go into the community, speak to the folks who are receiving the services. You know, we may be providing services that they don't need. They may not need. Don't want. And so if it's our job to focus on the senior population and ensuring that seniors receive the necessary services so that they can age gracefully, with dignity, and remain in the community, it is our job to help.
And in their homes.
In their homes. There you go.
As long as they can.
Absolutely. We want them to be at home. And then to be able to measure that success and know that you're someone who's very a strong proponent of looking at outcome measurements. Don't tell me how many people just went to the center today. How many folks we provided lunch today. But have we increased the age in terms of folks, the average age of folks remaining in their homes for as long as possible? That's how we start moving the needle and being able to collect sound data and being able to hear from the people so that we can shape this plan. And so we'll begin a series of 4 public forums the week of September the 21st. And we want to hear from advocates. We want to hear from seniors, their family members, from nonprofit organizations, for-profit organizations, government officials within Fulton County. We want them to weigh in and shape this plan.
We're going to be disseminating information that we received from the department regarding the time and the location. We may be able to even put some of that information on the screen today.
Yes, ma'am. Thank you.
But one of the things that we've learned when we've had these meetings before and forums is the point that you're making about employment. We had a symposium, as you have heard, and the questions that came from seniors were surprising to many people. Along with housing, as we know, which remains critical.
Yes, ma'am.
Quality rental housing.
Yes, ma'am.
I had no idea until maybe 5 or 6 years ago that quality rental housing is critical.
It's very critical.
But to get to the point about employment, we know housing and small home repairs. Small home repairs, that program has just been overrun. There's no way we can meet the need there. That we have met the need today. That when you have 400 folks on it waiting list, you're not meeting the need.
Absolutely not.
But employment.
Yes, ma'am.
Employment, housing, yes, transportation, because senior adults are not going to be isolated, nor are they going to be marginalized in this county.
No,
I don't know about anywhere else, but nobody's going to be able to put them in a place and say, you stay here.
Right.
So transportation is very, very important, and we've been told by experts in your field as well as in health that isolation is not good.
It is not good. And if I can just talk about that for a quick second.
Yes,
by
by
social
all
isolation.
means.
Yes, ma'am. Social isolation is a huge issue nationwide, And
Yes.
when you think about social isolation, it leads to a domino effect. So when that senior is isolated, it leads to depression and other issues. That senior
Depression is big too, I
is
understand.
very huge, and that leads to mental illness. And then if they have that mental illness and with that depression, they're not eating properly, and so you can imagine that person is not physically healthy. And if they're not physically healthy, it leads to an increased likelihood of falling. And so we're talking about seniors who fall within their homes and have that fractured hip. And fractured hips, I know in Washington, D.C., a small jurisdiction, but we counted about 90 or so seniors who would die a year because of a preventable fall, whether it's because of malnutrition or some other reason. But social isolation was a common thread for those individuals. And so that's something I want to make sure that we tackle here in Fulton County. Yes, we have folks who come to the multipurpose centers, to the senior centers, but what about those seniors who are not even
The
touching?
frail elderly.
The frail elderly, thank you, ma'am, who may have family members in other parts of the country or even the world for that matter, who
Yes.
probably no longer going to church. And yes, as a minister, and I tell folks, it's good to pray for those on the sick and shut-in list, but
Yeah.
get off of your knees and go and help them. Go and
Yes.
serve them.
Yes.
Go and serve, even the smallest church, if you
Yeah.
can imagine, one family member adopting that senior who's sick and shut in one day a week. Even the smallest church can make sure they can reach out and touch that senior. So we really have to look at a village concept and being able to figure out what do we need to do to help our most vulnerable folks in the county.
We're going to come back to that. We're going to take a short break
Yes,
now,
ma'am.
Dr. Thompson, and we'll be right back.
Thank you,
Stay
ma'am.
with us. Dr. Thompson, you were saying that programs for the government, programs in the faith community, whatever the program is, it has to be based upon the legitimate needs of seniors.
Absolutely.
And in order to know what their needs are, that must be, I like that words you use, there must be a touching.
Yes, ma'am.
Online is good, I say
Yes,
many times.
Yes, sir.
Face to face is better.
Better. Absolutely.
Tell us,
Absolutely.
Dr. Thompson, some of the things that not only here and as public policy and programs,
Yes, ma'am.
but things the community can do to strengthen.
Oh, absolutely. So my philosophy when I think about government programs, we don't have an endless pot of money. Whether we're looking at the federal
Very
government,
finite.
very finite.
Yes.
State government, local government, county
Yes.
government, we have a set budget, and I don't think it's the government's responsibility to do everything.
Okay.
It's not the panacea. It's not
Yes.
the end all be all. And one thing
Yes.
is good is when we have our nonprofit partners or even for-profit entities, especially when I think about not on the nonprofit world, our faith-based community.
Yes.
You have Mother Jones who was there for 20, 30, 40, 50 years and head of the mother's board and has done so much for the church, and somehow she's taken ill, went to the hospital, returned home, and we're trying to figure out whether she has a meal or not. So yeah, as I tell folks, pray for her, but go and see her.
Oh, yes.
Regardless of the internet and technology, the human touch has been around for centuries.
And it works.
It works. It will never go away.
Yes.
And that folks thrive off of that human touch,
Oh,
that
yes.
contact. And so when I think about the church community, is something that we did in Washington, D.C. as senior villages. We started these nonprofit organizations. So as the government entity, we provided technical assistance
Yes.
to these nonprofit organizations to in essence, to birth what we call senior villages. And senior villages are a grassroots organization. They pop up around the town, and the purpose is to make sure that seniors and other vulnerable folks who may not necessarily be seniors receive the necessary services so that they can remain successfully in their own home.
Many times it's a matter of information.
Absolutely.
They don't know
Absolutely.
where
That's what it's all
or
about.
who to turn
Absolutely.
to for assistance.
Yes, ma'am.
I like that. I saw that that concept in the materials that you sent us.
Yes, ma'am.
Yes, so that's very exciting.
It's very exciting. And let me also add that when we think about senior villages, especially when a community is pooling the resources together, it's a chance for this village to work with the different vendors and the business community and say, hey, give discounts to our seniors. We will patronize you, and then so you get that discount, and for the business community, it affords them or it enables them to know that, hey, I will get more business.
And you know they're waiting for that information, Dr.
Absolutely.
Thompson?
Absolutely.
There are many businesses, they want to help, and they want to do more than have
Yes,
you
ma'am.
come by Thanksgiving
Right.
and you know, and ask them to participate in a
Yes,
food
ma'am.
drive.
Right.
And that's the other thing I liked about that concept.
Yes, ma'am.
There are many businesses in our community I want to help, and they've been major contributors, you know, to our programs. But I think that the idea that here are people coming to ask me who are doing something themselves.
Right.
You know, I like that concept, and that works very, very well.
Absolutely.
So how can we here in government support the community efforts, support the faith communities, support the nonprofits? You know, what is our unique role? Because these folks have been paying taxes a long time.
A long time. And I think the first step would be this strategic plan. Is to really
coming together
to
decide.
and lay it on the table. And let me say, and I applaud and salute County Manager Dick Anderson. He gets it. Coming from the private industry, he understands a solid strategic plan. But he'll also agree that a solid strategic plan means nothing if it's sitting on the shelf. Right, so it's being able to get the right input, the folks to the table, and to be able to shape it. But also the important thing is to be able to execute. And that's one thing I'm confident in working with the team at Aging and Youth Services that we will roll out this strategic
Execution.
plan. Execution is so important. And
it's
then,
kind of what we're interested in.
Absolutely. Execute it and also hold ourselves accountable
Sure.
for the outcomes. And so coming to you, and you have of course, you're the leader, and you'll see exactly what we're doing, and the other commissioners, your fellow commissioners, as well as the community, the taxpayers. You know, we're ultimately accountable to the taxpayers, so they'll know we're going in this direction. You'll see the benchmarks along the way. If we're missing the mark, we better hurry up and correct the sale so we can go in the right direction, and so we'll get there.
We have new names for it. We call it outcomes.
Yes, ma'am.
But what we once called it was results.
Results.
And everybody knows what results are.
That's the bottom line.
And what I always say about planning, while we are planning, you know, somebody's got to serve those meals out there.
Yes, ma'am.
Somebody's got to provide transportation.
Yes, ma'am.
You know, they go hand in hand. I've said many times that as policymakers, it's our responsibility to establish the priorities.
Yes.
But we can't establish the priorities until we know and hear directly from the people. And we hear from them first. That's just the way it is.
Right.
We hear from them first because our names are the only names on the ballot.
Right.
And and so they know where the first lines are in terms of accountability. But without the kinds of information and data, without the skills that come from staff, you know, we cannot meet our responsibilities to people. So in our aging program, we focused a lot on decentralizing senior services.
Yes, ma'am.
Over 20 years ago, a group of seniors from North Fulton, South Fulton, and Atlanta. They didn't deal too much in North and South in those days.
Okay.
It was just senior adults. They came together and said to this Board of Commissioners, we want to be treated with respect and dignity, and we would like to have senior services decentralized and accessible to us in our neighborhoods.
Yes,
and this is how the famous senior multipurpose program began.
Yes, ma'am.
And of course, we had neighborhood centers too in every neighborhood. And so the Dorothy Benson Center in Sandy Springs, the Helene Mills Center in Central Fulton in Atlanta, the Harriet Darnell Center in Southwest Atlanta, and the H.W. Bowden Center in East Point are there because seniors came together and told us what they wanted done.
Yes, ma'am.
And without the staff, without your development of this data, without your understanding of what the needs and interests are of seniors, we could not do it. Dr. Thompson, we're going to have the information that you have given us about the forums made available to seniors. Of course, I know the department has its own program of communication and public information. We certainly want to support that. We're going to run that on the screen.
Thank you.
And we are just very, very, very pleased to see the Department of Aging and Youth.
Yes,
When you
ma'am.
come back next time,
Yes, ma'am.
we're going to talk about youth.
Absolutely.
Because
Thank
if
you,
I get
ma'am.
any one question from senior adults is, Emma, what are we going to do about
Yes,
our
ma'am.
children
Absolutely.
and our grandchildren? So we're going to talk
Thank you,
about
ma'am.
that next time.
Thank you.
Thank you so
Thank
much,
you
Dr.
so much.
Thompson.
God bless
We
you. Thank you,
appreciate
ma'am.
it, and we are just very, very excited
Thank you.
about entering into another year
Yes, ma'am.
of service to the people who have meant so much
Yes, ma'am.
to
Thank you.
the strength and vitality of this county.
Absolutely.
Thank you.
Thank you.
Again.
Thank you.
I'll be back in a moment with closing thoughts. We must be careful, the poet said, that we do not minimize the actions of our fathers and mothers. We must be careful. We must be careful that our recognition of and appreciation for the extraordinary contributions of senior adults have made to the strength and vitality of this community is not restricted to programs and processes and planning. Maybe the best evidence of our respect for senior adults will be in what we do to preserve the safety, the health, and the dignity of all people in Fulton County, irrespective of age, income, or circumstance. That's all the time we have for today's conversation. Until next time, stay strong. To learn more about today's conversation, contact me at 404-612-8222. That's 404-612-8222. You can also email me at emma.darnell@fultoncountyga.gov. Visit us online at emmadarnell.com or connect with us on Facebook or Twitter.